We are now wrapping up the symposium. I hope you enjoyed the 1.5 days so far, and I think the end panel is always intended to just get our thoughts around and discuss a little bit, like strategies moving forward. So I'm very glad to introduce Melina Claussnitzer, who will moderate that session. Melina is a bit like the other members. She has many, many roles. So one is actually that she is an institute member of the Broad Institute of the MIT, and she's also an associate professor of medicine at the Harvard Medical School. With lots of research interests, and I think she will be fantastically moderating this session. And as the others, she's a scientific advisory board member for National Nutrition Research. So, Melina, over to you.
Thank you so much, Petra, for the kind introduction. It's just wonderful to be here, really. My flight arrived very late yesterday. I got stuck in Paris, so I missed actually the entire symposium yesterday, but what I can take from the dinner we had with lovely discussions and really thought-provoking interactions and the fantastic presentations today, very enjoyable, very insightful and thought-provoking. And on this kind of, Petra called it connecting the dots on this logic sequential path going from nutrients to meals to balanced diets. What I have the great pleasure and honor to do now is to moderate the panel discussion where we are tackling the question on how do we bring balanced diet to life across needs and life stages. So the importance of that, discussion of that particular question of a balanced diet couldn't be more important given the immense global challenges that we have touched on many of them over the last 2 days. I'm sorry. that needed to get out. It feels much better now. That needed to get out. Massive, immense global challenges that we are facing and we touched base on. We are looking at socioeconomic, socio-demographic variables. We are looking at climate change that affects different regions and countries in the world in different ways. We are looking at malnutrition in the context of obesity, undernutrition, and micronutrient deficiencies. So I just want to take a step back and kind of reflect on and look at the numbers that we are all aware of. But I think it's a reality check that is important to take every now and then, which is that as of 2022, we are looking at 2.5 billion people that are overweight or obese. So that is more than 1 out of 4 adults of the world's population. And projections suggest that by 2050, we are reaching every, 1 out of 2 people of the world's population will be overweight or obese, with all of its medical implications. So these are horrendous numbers. And on the other side, we are looking at 735 million people that faced hunger in 2022 and are undernourished. When we look at numbers for children, it's horrendous. So children under 5, there are 148 million children that are stunted, 45 million that are affected by wasting, and 37 million that are dealing with overweight. These numbers are horrifying. Right, and we need to do something about it. And it just kind of, the numbers reflect an urgent, a critical need to really understand the challenges, define the challenges better, and develop evidence-based strategies and solutions for a balanced diet that can be implemented efficiently and at scale across the globe. So it reaches everyone, and particularly those that are affected the most. So I'm thrilled to welcome 5 panelists to join me here on stage. The panelists will introduce themselves, and I will just say they are bridging the diverse expertises and perspectives that, Asha, come in front, yeah. They are bridging the different perspectives and expertises that we need, the different sectors. We have Hyder. There we go, great, thank you. We have Hyder from the World Bank, representing the public sector, the international financial sector. We have Professor Pierre Chandon from academic sciences, and we have Professor Seoul Lim Thank you for joining us. Also from the academic sciences, we have Mauro Fisberg, also from the academic sciences, and then we have Dr. Asha Chesnutt representing the private sector. The way we are going to do this now is that I let all of you introduce yourself really briefly in 2 to 3 minutes, and then I'm going to ask the panelists a few questions that touch on challenges and solutions in the context of a balanced diet, and then we're going to open up the floor for a lively discussion with all of you here. So, Zia, would you take the stage and introduce yourself real quick?
Thank you. So, my name is Ziauddin Hyder, and you can call me Zia. Of course, I work for the World Bank, and I'm anchored within health, nutrition, population. We call global practice of the bank. But since I'm a nutrition specialist at the bank, I work mostly with 5 different global practices. That includes health, nutrition, population, agriculture, water, education, and social protection. And this is because, as you know, you come from nutrition, many of you come from nutrition community. Malnutrition is a multi-sectoral issue, and unless you work with multiple sectors to achieve common objective, 1 or 2 sector cannot do much. So I've been with the World Bank since like 17 years. I was in Africa for almost a decade. I was in East Asia. Now I'm in South Asia. So I mostly work in Pakistan, Nepal, Sri Lanka, in these countries. And because of obvious reasons, since World Bank is a multilateral development agency, and we have 2 goals, shared prosperity and reduced poverty. And within the context of two goals, stunting is our actually core issue, to address. Of course, we work to prevent NCDs. We help countries to prevent NCDs, prevent obesity. But as far as nutrition is concerned, unlike WFP, UNICEF, they work to address acute malnutrition, but our work is mostly focused on reducing stunting. And within the context of stunting, as you know, that even until today, until recently, the theory of change for stunting reduction is too much geared towards health, neglecting the food system, neglecting wash, neglecting climate change, which are emerging as very, very important issue. And within food system, I think that's the focus of our discussion today. We have many challenges. I just give you one example from Pakistan, how food system has been suffering. In Pakistan, if you look at the statistics, only 10% of children 6 months to 23 months have dietary diversity. Only 8% of the children, same age group, have minimum acceptable diet. So I just gave you 2 examples. And if you look at the trend, this is happening over the last decades. No improvement, little improvement, again decline, little improvement, again decline. So that means something is going wrong, severely wrong in food system. And I will come back later to kind of suggest a couple of way forward that I think is very important to address food system. So I will stop there.
Wonderful. Thank you, Zia. Mauro, would you give us a quick introduction on your end? And we are going into challenges and solutions after.
Okay. Good afternoon, everyone. It's a pleasure being here. Especially, I would like to thank Melina and like Petra and all the team of Nestlé for inviting us. My name is Mauro Fisberg. As you know, I am a pediatrician and nutritionist. I'm a professor at the Federal University of São Paulo in Brazil, and also I coordinate a research center on feeding difficulties and nutrition in the Instituto Pense, the Pense Institute in São Paulo, Brazil. My main research area is feeding difficulties, micronutrient deficiencies, and in the last few years I've been coordinating the Latin American study of nutrition and health. It's a huge study in Latin America with 8 representative surveys of each country. and with more than 10,000 people from 15 to 65 years old. And we have seen that the majority of the population they are sedentary, they have high energy, 61% of them are overweight and obese, 30% are obese. And coming to the children's situation very, very quickly, I think we have to cope with the 4 issues of the malnutrition, from very severe malnutrition to very, very severe obesity, together with hidden hunger and stunting at the same time, in a not so poor society. It's a developing society together with regions with very, very high developed societies. So we have to cope with all these things at the same time. I think this is the beginning of discussion.
Yeah, wonderful. Thank you, Mauro and Pierre.
Thank you, Melina. Hello, everyone. So my name is Pierre Chandon. I'm a marketing professor at INSEAD Business School. It's a school in Paris and Singapore. And I study how the environment, including food marketing, labeling, influences eating behaviors. And I focus on nudges, which are non-economic interventions, so not changing price, and with a particular interest in portion size choice. For a day and a half, we talked a lot about what to eat, a little bit about when to eat, but how much? Not so much. And I think it's really the sweet spot, because we as consumers have much stronger preferences for what to eat and also when to eat than for how much. It's mostly determined by the environment, but what you guys at Nestlé and the others offer. And my hope is to find interventions that help better align health, business, and the pleasure of eating. Because I'm half French, half Italian, and I think eating enjoyment is really important. And you'll hear, maybe later how I developed some ideas that pleasure, not health or nutrition, can be the ally of healthier eating.
Hi, everyone. My name is Asha Chesnutt, and I'm a pulmonary and critical care physician, and I'm part of the health org at Apple, and we're the organization within Apple that's responsible for the health and wellness features on Apple devices like that you see on your watch or iPhone. When I speak, people often ask me, like, what is Apple's vision on health? And I really sum it up in one sentence, and it's in our literature as well, and that is that we really want to empower our users with their own personal data to help them make better choices and live a better day and live a better life. And that's really what we're out to do, and that's kind of our mission statement. And it's important to realize, too, that we have a really holistic view on what that is. And, I think it starts with the fitness rings and walking more, but it also includes mindfulness and mental well-being and improving your sleep. And so it's really a very holistic view that we bring toward all our features.
Great.
I have a microphone here. So my name is Sue from South Korea. Actually, I'm a physician by training. I mostly see patients with diabetes and obesity. And as you know, the obesity is a truly growing health issue with approximately 1 billion people affected as of 2020. And it can be projected to 15 billion in 2040. So now we will be facing a huge burden of the health burden or economic burden to our general public due to chronic disorders, obesity-related disorders. Just for your information, the WHO recommended a lower cutoff point of BMI for defined obesity in Asian population, BMI 25. In that case, the almost 1/3 of the population in my country are suffering from obesity. So there is a huge increase over the past 2 decades. But when we use the original BMI cutoff, I mean the BMI 30, as you know, Melina already knew I think 40% of American citizens belong to obesity. When you use the same BMI cutoff, 4% of Korean people are suffering from obesity, but please guess, the prevalence of diabetes is almost the same. 13% in general public in my country are suffering from diabetes. So most Asian population are more vulnerable to chronic disorders, diabetes. So that's why I'm interested in clinical study with obesity. So now I'm pretty much involved in many clinical studies with Wegovy and Mounjaro, which has gone viral these days because the Elon Musk and the Oprah Winfrey and Kim Kardashian posted their before and after figure, used that kind of the expensive medications. The problem is those drugs are very outstanding in reducing body weight, but just after stopping the medication, the body weight increased, almost the same level. So we need more sustainable approach to maintain their reduced body weight. I think the Nestlé has to come in that position to support the more nutritious or dairy-based or plant-based protein to maintain their basic metabolic rate, not to avoid yo-yo phenomenon. So that's my first comment.
That's great, yeah. I have a follow-up comment that I bring in later. It's too specific now, but I wonder if we can all take a step back and reflect on how do you define balanced diets? I think there are diverse ways of defining what a balanced diet is, and I would love to kind of get a snapshot from all of you what your particular definition is and what you think, in terms of diverse nutritional needs, cultural practices, lifestyle factors that vary across regions, countries, and so forth. What's your take? Zia, do you want to start?
Yep. So I think the standard definition of balanced diet, still to me stands, pretty much is right. I mean, making sure that individuals receive, acceptable, affordable, and safe, and nutritionally, complete food on the table. So I think that is still pretty much valid. But if we go back to the issue of, diet for young children, then this has a lot of cultural, issues. I mean, a balanced diet in, say, in South Asia, a country in South Asia would be very different from a balanced diet in Africa or Latin America. So the cultural, you have to put the scientific definition of balanced diet, within social and cultural context, right. To make sure that the entire concept is perceivable and acceptable, by your target population.
Right, yeah. Define the different variables, right? Socio-demographic, economic context.
That's correct.
Yeah. Mauro?
Yeah. I think I'll go to one age that was not already discussed here, especially the children issues. For us pediatricians, a balanced diet is something that is very theoretical, because we know many words that define it, because we know that we need to have growth, development, immunity, cognitive development, all the things together. But at the same time, you have nutrient adequate intake, acceptance. We have to have affordability, access, intrafamiliar division, age, and everything. Many words that are theoretical. But in children, we have to combine everything if he wants or not the diet. So it doesn't matter if we have a balanced diet if he's not accepting it. So we have to find a way to have something that is theoretical to put it into practice.
Right.
So the practice in children must be something that we have to transform language that's not usually accepted by parents, but it will be directed to a language that is be understood by children.
Great.
So a balanced diet is something that is all the things together, but at the same time enter inside the body of a child.
Thank you so much.
I didn't plan to answer it because I'm the only one who doesn't have a medical degree, but actually, I'm thinking a balanced diet to me is also one that takes into account supply.
Yeah.
Maybe because I'm French, when you have farmers who are driven to despair and block the country, you realize that the supply matters as well. That's the only point I will make here.
I was really intrigued by Dr. Gardner's presentation today and that table he had of all the different diets. And I think practically I've probably closely followed the Mediterranean diet, minus the fish, because I've been a lifelong vegetarian. But I think that just eating a lot of whole foods, fresh foods, whether they're grains, vegetables, and fruits, is what I think of as a healthy diet.
Yes, I think the a balanced diet is the one that can provide the essential nutrient in the right proportion to maintain their health and to prevent disease. From that perspective, I'd like to suggest the ideal the proportions of each macro the nutrient. For example, Korean Medical Association recommend the carbohydrate protein fat ratio of 55, 20, and 25. Still, many Asians consume less fat and higher carbohydrate, so that is not good for the general health. So many Asian guidelines suggest the consuming more fat, but on saturated fat, I mean good fat, not from processed fat. So we need more balanced diet for our health, and we also we should consider the cultural background and religious background and their lifestyle and their unmet need for balanced diet. Each country has different different situation, and every individual has different the situation and in terms of the economic burden, economic and social background. So we have to tailor our recommendation for balanced diet to meet their unmet need.
Yeah, no, that's great. I think all of these different perspectives point very well to context matters, right? The context matters of what a balanced diet actually is. And moving from the definition or the expanded context-specific balanced diet implications, I want to go towards challenges, and we have discussed a few of them already with Zia and Mauro. Let's take a global approach and think about what are the most pressing challenges that you see globally to implement a healthy diet, a balanced diet.
Shall I?
Totally.
So, well, challenges are so many.
Yeah.
And I'm a practitioner. You know, we face those challenges almost on a daily basis at the country level. But I can highlight few. I think the first overarching challenge is institutional. In order to make sure that the target population is reached, most of the developing, the countries in low income and even some middle income countries, they seriously lack institutional framework. Because as I said, like I work with 5 different sectors. That means 5 different ministries at the country level. Even within a single ministry, there are so much incoordination across divisions, not to talk about across ministries. So that's a big challenge. And these challenges compounded because the government, until today, when it is the issue of nutrition, they always look at donors. They always think this should be donor-driven. Donors should come in and, put some money. And government loves to look at it from project perspective. They don't try to integrate within the country system. So that's what nutrition has been facing. I would say, I studied nutrition back in 1991. This challenge was then very much alive. I don't see much change even until today in terms of government commitment, understanding, and interministerial, within ministry coordination and institutional setting. That's the biggest challenge. Now, since I'm sitting in a private sector, meeting, I think another big challenge is public-private partnership.
Right.
Because I talked about food system, and food system cannot be addressed without having a strong partnership. But if you look at, what is happening, I mean, it's a very catchy word. We love to have it in all meetings, but go down to the country level where things happen. I don't see much public-private partnership in health and nutrition. It's very challenging. The major issue there is lack of trust. I mean, if you, as a private sector or as a public sector, vice versa, if you meet, the culture of trust is completely absent, even until today. And that is inhibiting, many good things to move forward. So I think we need to understand, have deeper understanding, what is the political economy, why public sector should feel threatened or private sector should feel threatened, to come together and work as a single entity. Why is that happening? I think we need to look deeper, understand this issue better before we can come up with some doable solution.
Do you know about a case where this actually worked? Public-private relationship and partnership?
In nutrition is very limited way, maybe in food fortification.
Right.
But to be honest, I sit in many country-level meetings where we discuss food fortification. I don't see a private sector partner over there. They're not even invited.
So important.
Somehow it is a stigma to invite a private sector partner in a policy meeting.
Right.
And I was listening to Stefan. I think you talked about stigma. No, processed food has been suffering from unhealthy stigma. So it's not just processed food, but the entire the entities, the private sector, who have been primarily responsible to making sure to produce and make processed available in the market at a affordable cost, they are being stigmatized in the entire domain. So I think that's a big challenge.
Yeah.
It politically may be very complicated, politically tricky, but unless this is addressed, I don't think we can move much.
Yeah, I totally agree.
Well, I think we have one big challenge is translate all the big ideas that we have, especially all the beautiful words that we have, affordability, accessibility, all the elitists, into something that could be practical.
Right.
Especially for mothers who have to work all day and they have to prepare their meals and the meals for children and for the whole family. And she has to cope with something that she needs to prepare things for school, she has to prepare things for the whole day, and we have to combine foods that could be practical, easy to prepare, that be affordable, and it's the difficulties we have, especially if we are trying to have only beautiful things, nature foods, or only organic foods or something like that. I think it's very important to have something that we have translate all the beautiful words that we have in nutrition to something that could be practical and inside the reality of the majority of the families, and not only on the low socioeconomic classes. I think especially the reality of all ourselves as professionals is exactly the same.
Yeah.
We have the same challenges in different level, but we have the same practices. We need to be practical, we need to be easy to prepare things, we have to be very easy to distribute things, and that could be our great challenge.
Right, it has to be...
How to interpret
right.
all these ideas into something practical.
Yeah, thank you. Pierre, do you want to...
So I feel really bad to say this after a day and a half where I've actually learned so much, but I believe from a consumer standpoint, it's not so much knowledge. I mean, I like to say that healthy eating is less of a knowing problem than a doing problem. I mean, at the basic level, you and I consumers know you're supposed to drink more water and less soda, eat more fruits and veg. We just don't do it because, the costs are now and the benefits in the future. And so to me, the challenge is really how do we change behaviors as opposed to how do we actually educate or teach consumers and give them more facts, more knowledge. I will look at like that. Maybe we can talk about how we get there later. But to me, that's the biggest challenge.
Yeah, absolutely. Asha, do you want to share some notes?
Yes, I'm totally agree with the Pierre's opinion. So we have to educate our children and adolescents first, because they usually more familiar with the more energy condensed drink, I mean sugar sweetened beverage and high fat content McDonald's or something like that. So you will be surprised when you come to many Asian countries. There are more the international coffee chains or the burger chains are overwhelmingly well located. In every corner you can find the burger joint, burger store and the coffee store, and they usually go there and order long specialty coffee frappuccino with whipping cream, not Americano. So that's a big problem. So we have to educate our young generation toward choosing the healthier food item compared to the high fat, high cholesterol diet.
Yeah, absolutely.
Just a comment. One of the problems that discussing the partnership, private and public, the majority of the projects that we have, especially in our country, in Latin America, is for diagnosis.
Right.
Big projects for diagnosis, but we have very few projects for intervention, and especially because we are treating the population like children, because the majority of the interventions is something like we need to modify behaviors that are not cultural accepted, that are not traditional accepted. So I think we will have to be very careful on the kind of interventions with this kind of public-private intervention together. One of the most important experiences that we had was the Incaparina experience in Guatemala, in Central America, when they try to change behaviors. One of the problems that we have in Brazil was the initiative of trying to establish soy as a project for increasing protein in our country, but soy was directed, for the majority of the people, was directed for, especially for cows. So it was totally difficult for them. So trying to have public partnership must be directed to intervention now and not for diagnosis, because we have full numbers, but we don't have something.
We have to learn intervene, that's right. So lots of challenges that we are facing.
One more challenge?
One more challenge.
Yeah. No, I thought this is very relevant. I think another challenge is not lack of, but inadequate innovation.
Yeah, I was just going to switch over to innovation.
If you look at the markets in the West,
right,
there are so many processed, fortified food. But I think unless you come out of the box and you do innovation in product design and innovation in product marketing to make it affordable for consumers in poor setting, you are actually missing out the majority of the global population.
Yeah.
So more and more innovation is needed in order to really to penetrate rural markets and rich population who are in dire need of fortified food.
Yeah, no, that's the perfect bridge to the solutions, which I would love to spend some time on now, to think about what are emerging technological advances that you can see, emerging innovative strategies that you think are most promising currently occurring. So, Mauro, do you want to?
Yeah, I think especially for children, we have to try to use their own habits in order to try to modify their behavior or try to establish education programs. One of the examples that we had, it was the active games. Activity games were very important at the beginning, but probably the language of these games were not exactly, they were not so adventurous like it was the real games that they were used to be. So I think we have to establish something more approachable for the children.
For education, you mean, correct? But
activity games is something that could be, if you have internet, if you have high-speed internet, if you have possibilities of affordability or distribution for these games, it could be interesting for activity. Other example, it could be the diagnosis, the distance diagnosis, especially for regions that you do not have accessibility or you do not have medical access. So you can have possibility of teleconsultation, and you have all possibilities of having distant care. You can have auscultation. You can use the apparatus like Title Care or something that could be very interesting. I think we have to use some of the measurements that Apple and Samsung and other manufacturers have done in order we have to discuss much more with the people who are in the top of the line, so we can try to use their facilities for our use.
Yeah, thank you. Asha, I wonder if you could chime in on technical advancements in digital
As the,
health.
technology representative
Yeah.
on this panel. So I see the intersection between mobile technology. I mean, cell phones are ubiquitous now across the world, even in relatively impoverished countries. And I see them, mobile technology, helping the nutrition space in 4 discrete ways. And that's mostly, first is education. Second is to be able to assess nutritional status. Third is goal setting. And 4 is to reduce barriers. And if I break each of these down, the first one, education, can be country specific. I mean, we've heard, the myplate.gov, you have the UK, you have, guidelines in Asian countries that more conformist to an Asian diet. So it can be really empowering to be local and specific through apps created for mobile technology. The second is to assess nutritional status. You can take pictures of labels these days, pictures of recipes, and get a good idea of what might be a better choice to make or a better product to buy off the shelf. And then for goal setting, there's a variety, I mean, depending on how you feel about food logging, and I love your ideas on it, but nudging behavior and goal setting, and there's a lot of apps out there for habit tracking. And then finally would be the reduced barriers, and I think the pandemic taught us, this abundance of meal delivery services and meal planning services and different things that definitely are for the people who can afford that, but I do think that they have in some ways improved accessibility too.
Yeah, fantastic. Pierre, do you want to comment on the behavioral?
So if we agree that healthy eating is more of a doing and wanting than a knowing problem, first we know that just information doesn't work. I've done this huge study with the French government, 60 supermarkets, 1.6 million stickers with Nutri-Score and others applied. All of this, in the end, a big nothing. And actually, I have a parenthesis here. It seems a lot of what's transforming the business of food is going through changes in the supply more than in demand. Consumers are really hard to change what they want. So, Nutri-Score, it works a little bit for people who care about nutrition, for people we don't care about because they're already healthy. The rest of the people, just telling them what's healthy, what's not, it's not going to make a big difference. So what we have to do is we have to talk about what matters. What matters when we choose food is taste, taste, taste. Price, convenience. So pleasure as the ally of healthy eating. You can do it in 2 ways. First of all, sell a healthy food like junk food. If you say it's rich in antioxidants, etc., studies have shown people eat less of it. If you say it tastes, it's very simple. Sizzling Sichuan, very simple alliteration. It helps. The work I've been doing is also on quantity. If you describe the food on the sensory sensations, not just value for money, but you describe the aromas, the textures, the taste. People, at least in Europe, US a bit less, will, in all-you-can-eat buffet, eat 16% less. And at the end, they'll think the whole meal was way better. They're willing to pay 17% more. Why? Because savoring is the key to eating enjoyment. It's not quantity. And so that's, you talk to the heart with, talk about pleasure. And finally, I say talk to the hand. Manipulation, okay? What do I mean by that? Interventions such as changing the convenience and the portion sizes. We know they are the biggest effect. In the West, at least in the field studies, 3 times more effective than cognitive nudges, twice more effective than affective nudges, changing portion size. Let's go back to what used to be a normal portion size. For 70 years, Coca-Cola only had one size, 19 centiliter. It's not enough for a kid today, okay? And people really are open to that because they don't know what's a regular size. So you can reintroduce a smaller size. It makes the old small, the new medium. You can change the shape, where people are really willing to accept smaller size. You can change the convenience, and you change behaviors without changing beliefs or even motivations. And this is the key to sustainable effect because, as we know, these are repeated choices, repeated behaviors, and it's easy to do the right thing once, but not multiple times. So I really think the key is to put ourselves in the shoes of the consumers and talk about what's important to them. And unfortunately, it's not, in many cases, health and nutrition.
I believe it's not very easy to combine foods that at the same time they must be healthy, at the same time they have taste, they must be tasty, they must be pleasured, and at the same time they must be affordable, at the same time they must be beautiful, at the same time. It's a job that's very, very important. But I think reducing portions in some countries is reduce quality. They think if you are reducing, probably the industry are charging the same price for small volumes, and they think this is something, the product with small quality. So we have to be very careful on reducing portions, because sometimes if you increase portion, the population, they think it's something that's better, because if you have a soda that's very small, this is not enough. But if you have 2 liters that you can share or you can use itself, but almost just a little high price, they think that this is a better product than the small one.
If I can just talk about this, it's really important. One thing that we all know as consumers is the first gulp of the soda, or the beer, whatever, it gives us the highest pleasure. The second one, a bit less. If you have a really big portion, that chocolate dessert we had, on the first evening, doesn't really taste that great. Now, the thing we forget as consumers is that the overall remembered experience of that chocolate cake is not the sum of the pleasure we got from each bite, but really the average. And the last bite is very, very important. So if we have a portion that's too big, it's actually suboptimal from a pure pleasure standpoint. And if you just remind consumers to take into account the sensation, the pleasure of eating, we found with children and adults, they will themselves choose relatively smaller, not small, just normal portions. So there is a way actually that small is better for also a pleasure point of view. But it's not something that people intuitively remember. So that's an avenue for an intervention that's different from what we usually do.
So we have, lots of solutions, lots of innovations happening, inspiring, but I want to open up to everyone here and ask for contributions, questions to the panelists in terms of challenges, solutions whatsoever. Erich.
Thanks a lot for a very lively discussion and great ideas. And I try to follow a bit some of the things which were already said, because we know about the drivers with the consumer, so which is the palatability, the taste, the price, and at the same time should be healthy. We learned that very good concepts in a developed country like the UK, so 0.1% following the guidelines. So what is the way we can do in order to couple, let's say, the different drivers? And I would like to re-challenge a little bit a discussion we had yesterday. So of course it's a bit of an engineering biased opinion, but I think by technology and processing, I think you can make something more tasty. You can something healthy. We have the ideas, and you can certainly also make it cheaper. Huh? So I think technology is the driver, or processing is the driver. And the discussion we had yesterday, we probably have been guided in the wrong direction, because if you argue against processing, and with that kind of demonize your toolbox in order to really approach the coupling of these goodies, is this the wrong way? Are we guided into the wrong direction? I mean, I'm not sure whether you are that much convinced than I am that the processing and the technology is the way, but I think we have to couple the drivers for the consumers, and otherwise, I mean, it looks that education, I'm not saying that education is good enough, but education alone, I mean, UK is an educated country,
Yeah.
so 0.1%, that's completely disappointing, isn't it?
I'm happy to. So I think one aspect is also to think about what are the incentive structures for you guys. It's a very simple example. When Coca-Cola moved from incentivize its managers on volume to the number of units you sell, it doesn't matter if it's a 10 centiliter can or a 3-liter bottle. All of a sudden, they had great marketing ideas on how to sell smaller bottles, you know, which are often more profitable. So I think there's also something to be said here about, I like to say, a bit provocatively, that the big food act like big oil. You know, you know, business model is, I'm going to make more money by selling more calories, more energy to more people more often, etc. And the idea is, how do we move from this volume-based business model to one where I make more money and I grow and I innovate, which is what we want, by selling less food and more pleasure. So premiumization, I think in not every country, not in every product, etc., is a way up. You know, if people are happier with less food, as you know, the restaurant business, you know, has shown it's possible, then we're going to have this triple win for health, business, and the pleasure of eating.
We have questions there in the back.
Hi, Pierre. Thank you for the eloquent description of the application of portion. I like your commitment to this idea that it's possible, but we also know that there are significant barriers to the application of portion globally as a solution, because I guess, as Mauro's already pointed out, shrinkflation, this idea that smaller portions cost the same, and of course the saving isn't in the raw materials, the fixed costs remain the same, so it's very hard to pass any saving on the material onto the consumer because the fixed costs of production remain much the same. I wanted to ask you if you thought there were maybe other opportunities to have hybrid approaches where portion or convenience wouldn't be the only solution, but where you could bring other aspects, other tricks that we know in terms of things that you can combine and to help reduce intakes.
I'm happy you mentioned shrinkflation, because I was, you know, the media always asks me about this. And first of all, no one likes shrinkflation because it's a loss, but no one likes a price increase either. And for example, no one realizes that, you know, for example, 33% reduction in quantity for the same price is the same as a 50% increase in price. It's not the same. Now, if you present it that way, it's like, oh, you know. Plus, if it means that the product becomes below your budget, £1 or whatever, oh, then suddenly it becomes more interesting. That's why companies are doing it. The problem with shrinkflation is when it's hidden. The consumers are ballistic about it because it's in the back of the pack, and because they wrongly assume that quantities are regulated, which is only true for alcohol. They think someone is watching. No, no one is. And so when there's a price increase and they don't realize, they say, oh, it's my fault, I was a bad shopper. That's the game. But when it's a quantity decrease, they think, oh, it's terrible. So I agree with you that we shouldn't use one only portion size, etc. It has to be a full mix. The branding of small portions is terrible. It's always a mini. Who wants a mini? I want a gourmet, you know. I want the Fontainebleau size taste. I want the Vevey taste. I mean, if you think of, there are lots of, when it's packaged together with new recipes, etc., then you can make not a small portion, a normal portion. Interesting again.
Yeah.
That's spoken like a true marketing professor. Yeah, that's great.
Prof.
You've managed to convince me that getting less is better value now, Pierre. So that's a fantastic twist on the representation of the less. But I think there's a challenge there within that as well, because people still equate value with pleasure as well for some reason. In terms
Not
of
everywhere.
Yeah.
In France, people, for example, you know, in the US, yes. You tell French people this is delicious, etc. It's okay, I need less to be satisfied.
I can sign that statement. Yeah. No, please continue. I was just reinforcing your statement just now. Yeah. In the States, it's difficult. Right.
It's difficult. I agree, but it's not also. It can be. We find if you just ask people, think about last time you had a dessert. Think about the taste, the aroma, etc. Or if you describe the food, not on value for money, satiation, etc., the way we usually do, but on the sensory experience. You get people to slow down, and as Kieran has shown super well, when people slow down and savor, they eat less and they appreciate more.
Yeah.
So, you know, really that's the key. Pleasure in food doesn't increase with quantity. If we can
and stressing the pleasure rather than focusing on smaller portion sizes, which is
we have
particularly
research, especially with teenagers that are obese. They do eat faster they do not feel it out. They have to have the much more food in the mouth to feel the
Right,
so they
satiety
are
regulation.
hypersensitive. So I think that we have to be very careful on discussing portions. We are discussing portions or probably industrialized food, but we are not discussing on,
Right.
on
Yeah, no.
general staple food.
That granularity is important. We do know that satiety regulation is highly genetically controlled and environmentally dependent, but the general focus on savory aspect and pleasure, I think, makes a lot of sense in an individualized setting, context dependent, right? So I wonder, with the increasing global prevalence of obesity, from your clinical perspective, can you think about innovative strategies that are emerging and you would particularly feel are exciting to accelerate?
Before jumping into actually Asha already introduced the bright side of the technology. So now we are living in the era of technological advancement, but this time I would like to introduce the dark side of the technology. So after I had a opportunity to investigate the changes of cardiometabolic risk factors before and after COVID-19 pandemic at a national level, and we found that the most of the cardiometabolic risk factors had been deteriorating after COVID-19. And we found that Korea has, and many Asian countries, very strictly prohibited the mingling together and going out during COVID-19 pandemic. So what they did in their house is just downloaded the food app, delivery food app, and they ordered the food delivery, and most delivery food are energy dense and high calorie food, and they always require minimum 2 persons portion size, not 1 portion size, because the cost issue. So if you live alone, you have to order 2 portion size, and you have to eat a double. And that's a big problem. And then what happened to children? We couldn't ask them to go out, and they usually they go to their room and started their sports game on using their cell phone, English Premier soccer game usually. So the children now do not do regular exercise at all. They just stick to their cell phone. That's a big problem. I think the Apple or the other electronic company can develop the more active lifestyle apps or the more evidence-based app for food choices. So that would be the very ideal the technological advancements for general public to implement the lifestyle for better health.
Right. Adam was first.
Yes, so Pierre, I was very intrigued by your statement about Nutri-Score, that it does not work, because the French group from Bobigny has been publishing endless papers showing it works like magic and ought to be adopted across Europe as this solution. So what's your opinion?
I mean, I'm for Nutri-Score because you cannot be against transparency and information. For, let's say, even, from a consumer sovereignty point of view, consumers want it. I've just done a study now in fast food restaurants. 90% want it. But really, we found that it was so hard. Even we had 1.6 million purchases, okay, to find a statistically significant effect at the 10% level.
Huh.
So, and this is in the paper, it's published, what's fascinating to me is this, okay? I think Nutri-Score, like carbon footprint, by the way, they work, it's logical, for people who care about them. So they work for people who buy the A or B products. They don't really work, unfortunately, for people who buy the D or E products. If they know, and usually they do, because when you buy ice cream, you know it's not super healthy. And in fact, I think companies should put carbon footprint and Nutri-Score even on the bad products. Why? As long as people are not expecting that they're good. Why? Because then people are like, yeah, it's bad for the environment. You guess what? I had this frozen meal, it's beef with beef. I kind of knew, and I've shown through my purchases, I've revealed I don't care about something else. You get, you know, a great, I think, recognition from being transparent, and it doesn't make a huge difference. To me, the paradox is this. All of these things, maybe ultra processing is different. They don't really influence demand as much as we fear. Yeah. But then the industry gets panicky totally, and countries, etc., you know, and lobbying and all that, when in reality, it's probably not. So it works, this thing, thanks to you, because we reformulate like crazy, not because of consumers. That's the paradox.
So you're saying it works, but it makes no difference.
So it works because the industry is reformulating, etc. It doesn't. This is a big generalization. Let me just say this qualifier. I think it works for people who care about it, who are a minority of people who don't really need our help as much because they already care about health and nutrition. What's really important is how do we target people who don't care about health and nutrition. And this is where I think we need to move beyond. And I'm a strong believer in rewards through taste or something else, which was discussing before. If you reward people when they exercise or walk with points that, you know, even if they're really valueless, just the idea of I'm rewarding now, as opposed to being rewarding in a next life, which is not very motivating.
Ian, was your comment related to
yeah,
this?
it's related.
Okay.
And it's something that the Nestlé colleagues will have heard before from me as an advisor. And the critical thing from a nutritional perspective is it's the diet that has to be balanced, not the individual foods or meals.
Right.
Now, some people will take that as an excuse to have a very bad diet all the time. But most sensible people, especially if they're thinking about their children and they have enough money, this is a real problem that some parts of the world this is irrelevant for, because they just haven't got enough resource, they haven't got enough money. But those who can afford it, you know, they will try and do best for their children. And from personal experience, they'll try and do best for their grandchildren. And I've told the food industry before, if you really want to make a difference for kids, link up with the grandparents, because they've got more time, and they haven't got much patience from my experience, but they've got more time. But the important thing is a balanced, nutritionally balanced diet, not a food or a meal. And getting those things sorted out rationally is really what's critical here. Because rewards with indulgence help you eat the boring stuff. But you know, if you finish it off with a small portion of ice cream, then you know the stuff that came before it is acceptable.
Right.
So that's an important thing, I think, going forward.
Yeah, I could not agree more. We have more questions in the back.
Yeah, I was just thinking on building on the reward, and I'll start by saying that I get that at some point pleasure it's a way to do it, and I've seen it in Greece. Coca-Cola reintroduced this very small Coke cans, which was discontinued for many years. And the reason that happened is because we have much warmer summers, and people want really cold Coca-Cola, and I don't think that the 330 ml is going to stay cold enough for them to have the really refreshing feeling when they do it. But you open a small one, and from the first to the last gulp, it's going to be super cold, and you don't want extra ice or anything. You just want the pure undiluted thing. But linking to pleasure, so if we look at the latest guidelines for the treatment of obesity, we have all the various ways, but the Canadians did a great work on that. They said, if we want any guidelines to work, the number one reason people do not follow guidelines is because they come to dietitians, to doctors, and they feel stigmatized, and they don't want to discuss this anymore. They don't want to. They know what you will tell them. They don't want to engage because they feel that anything you tell them, it's propagating the stigma. And I'm wondering, are we doing this when we reduce portions? When do we reduce portions? Do we actually subconsciously tell people you should be eating less because you have extra weight? And could the pleasure angle help us in the sense that, I'm removing obesity, weight management completely from the equation, and I talk about something completely different, and I get my end goal.
I think we have to discuss pleasure and control. Usually pleasure is something that we try to achieve, but at the same time, if you have too much, we'll have problems. So I think it's accompanied by something that must be controlled. If you're establishing portions, we have to understand that portions could be difficult for in any cultural possibilities, especially in some places, in some countries. To have huge meals means that they are filling the stomach, and so they are ready to work and they are ready to produce every day. So they do not want to reduce their intake. Even if you are reducing the portions, they will take double or they take 3 times the portion that you are giving them, because they feel that they must fill their stomach in order to work, in order to be healthy. So I think it's difficult.
Though educational strategies are important to educate about portion sizes and satiety control and so forth.
But I guess this is also pretty much, it depends on, is it okay?
Yeah, I think so.
Yeah, it depends on what particular food item you're talking about.
Yeah, absolutely.
That's one. And second is, I just wanted to add another dimension to what you said about reducing portion. I think that can contribute to increased affordability, right? If you reduce portion, that means more and more number can afford them. So
if you reduce price.
Right,
yeah,
it has to be covered.
price has to be
right?
reduced by portion, right?
I want to go, and Eileen?
Yeah,
you have a question?
I think we've discussed an awful lot of things. When you think about how we can change,
Right.
we can talk about reformulation, changes in portion size and everything, but what I think we need to go back to is this change in behavior.
Yeah.
And when you consider the choices that are made, so there's a choice at purchase, and then there's a choice at consumption. And one thing that has not been chatted here, and it's very much in the developed world, is that food environment. And we've started to do an awful lot of work in the retail food environment to understand, where foods are placed in the retail food environment, where they're, the rules governing price and promotion and location and provision of all of those. So I just wondered how the panel thought of that, because it's not represented here at all and hadn't been mentioned. And I think it's important, Pierre, you've mentioned that, where we need to understand where the choices are being made to be able to influence the behavior at each of those points of choice.
Absolutely, and all of this is obviously important. What we know is, unfortunately, it's not as simple as let's have fruits and vegetables in fruit deserts. Okay, we know that. And I want to go back to the issue of food versus diets. I think there's one thing that I found the most interesting in some of the work I've done with the cheese, the dairy industry. There's nothing they can do about the cheese. Roquefort, the recipe, that's it. Low-fat cheese, Roquefort doesn't exist. It's a horrible thought. Scratch that thought. So the idea is, I'm going to sell a dish, and I'm going to have a Nutri-Score on the dish. Well, you can do that. We've Nutri-Scored lots of fast food meals. And all of a sudden, you can do a promotion. Buy my cheese, I'll give you 50 cents off. And then if you buy also a kilogram of zucchini, okay? So I think we can be innovative here in how we move from just saying, we just make healthy food available on the shelf, and then it's not my problem what happens, which is not acceptable anymore, to try to think about, no, I care about my products are selling, and I care about how much people are eating. And if we do that, there are many innovative things that can be done on portion size choice. Just one, if you elongate a packaging, you can make it appear to hold more food, up to 24% in my studies, even when people are incentivized to really tell which one is bigger, because our eyes are really bad at geometry. We tend to estimate volume from the surface area of objects. It's a visual illusion, okay? If you elongate something, you increase the surface to volume, and people will think there's more when there's less. Or you cut it into slices. People tend to estimate quantity in the plate from the number of units and disregard the size of the units. And these are domains that are largely unexplored that I think are worth discussing and studying and implementing, especially.
By the way, I was disappointed the size of the cake served last night. So I expected the larger size, but what I want to say is the portion size is very important because a human usually tend to finish off. The portion size is very important to reduce our consumption of high fat, high carbohydrate.
Right.
People who are on semaglutide, etc., how do they respond to portion size?
Oh, yes. It is very striking. When we prescribe semaglutide or the tirzepatide, they reduce their hedonic appetite. They more toward the healthy appetite. That is very interesting drug.
Smaller portion.
Yes.
So we have one quick, is it a quick question, and then we have to close the discussion?
Perhaps it'll be quick, but I think it's an important dimension.
Yeah.
You know, total energy intake is a function of portion size and eating frequency. Nobody said anything about that.
Frequency.
Snacking now represents about 20% of daily intake. It's equivalent to breakfast. I would argue that eating frequency is actually more problematic than portion size even.
Yeah.
It seems to be tracking BMI better than portion size.
And it's exactly what Ian commented. It's about the diet. It's not about the food that we're discussing here. It's about implementing a balanced diet through various strategies. So I think this is a topic that we could go on and discuss additional challenges, additional solutions and strategies. Time is limited. I know Petra is standing behind me already. So I think we covered a lot of ground, but by far not all. I think what I take from this, everyone here had very diverse perspectives, including myself. And I think coming together, discussing, forming partnerships, Zia, you mentioned private public sector partnerships, understanding each other and working hand in hand to implement efficient solutions is what we all have to work on moving forward. So I want to thank the panelists and everyone here in the audience for the great contributions, and lovely to see you all. Have a safe travel back home.
Thank you so much.